doing well. Welcome to Facebook Live from Apollo Hospital. Today, we have with us Dr. Girish Navasundi, Senior Consultant and Interventional Cardiologist, Apollo Hospitals, Kalangata Road, Bangalore. Dr. Girish has an experience of 16 years in the field of cardiology and has performed more than 5,000 angiograms and more than 2,000 angioplasties, both coronary and peripheral. He has also performed transcatheter treatment for valvular heart disease and aortic aneurysm. His special expertise lies in performing complex coronary angioplasties, image-guided angioplasties, chronic total occlusion angioplasties, and developing and executing heart failure and sudden cardiac death treatment strategies. He has an extensive experience in the usage of rotablation, OCT, IVAS, FFR, IABP, crystal production devices, cover stents, and IVC filters. He has a certain unique credits to his name, like he was the first cardiologist to implant absorb stent in private healthcare sector in the state of Karnataka. He is the first cardiologist to implant MRI compatible AICD system in the state of Karnataka. He was also the first cardiologist to implant tapering coronary stent in the state of Karnataka. It's an immense pleasure for me to welcome Dr. Girish to the session today. He will be speaking about heart attack and heart failure. Kindly send your questions to the comment section. Over to you, sir.
Thank you, Dr. Vino. So, welcome, viewers. I will probably go on discussing about heart attack and heart failure today. I will put them in a form of questions so that it can answer some of the commonly asked queries. The first question that I was asked is heart failure and heart attack both same? No, they both are different. Heart attack is a condition where the blood supply to the heart suddenly reduces, either completely stops or becomes severely reduced, leading to reduced oxygen supply to the heart muscle, which suffers a small injury or a major injury depending on total blockage or a partial blockage. This is called heart attack. Heart attack leads to partial closure of the blood flow and death of the heart muscles when a person starts developing sudden symptoms like chest pain, breathing difficulty, or gaseous distension, occasionally excessive sweating, tiredness, and sudden unconsciousness. This is heart attack. The second component or second entity is the heart failure. Heart failure is a condition where heart is unable to pump adequate amount of blood to meet the demands of the body. This could be a sequelae of a heart attack. What does it mean? A normal healthy heart, usually when it pumps, it ejects 55 to 65% of its content with each contraction. That is called ejection fraction. Means if there was 100 milliliter of blood in the heart, with each contraction, it ejects 55 to 65% of it. If the ejection fraction becomes lesser, that means heart's pumping becomes less efficacious, then it's called heart failure. That's why it's very important for all of us to know our ejection fraction, like the way we know our blood pressures or blood sugar or our cholesterol. If our ejection fraction is less than 50 or 55, then a person is called to be suffering from heart failure. So these are two different entities, heart attack and heart failure. The second question that was asked to me was, what are the main causes of heart failure? I think today we'll dedicate a little more time towards heart failure than heart attack. Heart failure, the causes. Commonest is the hypertension. When the blood pressure becomes very high, the heart has to pump against this resistance called blood pressure. When the blood pressure becomes very high, the pumping gradually becomes weaker and weaker and heart suffers. So that leads to heart failure. Commonest cause is the hypertension. Next comes the ischemic heart disease or the blockages in the heart pipe. Most commonly, because of blockages in the heart pipe, heart does not get adequate oxygen and food supply and its pumping ability gets reduced, leading to ischemic heart disease and heart dysfunction and heart failure. These are two most common causes. Apart from this, there are many causes like viral infections, some disorders which have been there from birth, like holes in the heart, or post-cancer chemotherapy or radiation can cause these are some of the commonest causes for heart failure. Then very important to understand this. What are the signs and symptoms of heart failure? You must understand. Heart attack, we know most of us speak about heart attack, which is different. Heart attack, the common symptoms are just discomfort. It need not be pain. Any discomfort like heaviness, tightness, squeezing, stabbing, burning. Many of them may just call acidity. They go and take over-the-counter medicines, and heart disease keeps progressing, and some of them die suddenly. So even severe burning can also be a symptom of heart attack. Apart from discomfort, a person can have breathing difficulty, excessive tiredness, occasionally sudden loss of consciousness. The discomfort usually is in the center of the chest, in the mid-rib region, and then you have on both the chest, usually felt as a tightness or heaviness, and it can come to both the shoulders and the inner part of the arm. It can go to the upper back. Occasionally, just the severe jaw pain is also a symptom of heart attack. Any discomfort between jaw and umbilicus persisting or causing severe discomfort, you must visit a cardiologist or do an ECG at least. These are symptoms of angina or heart attack symptoms. Now, we move away from heart attack to heart failure. Heart failure is a condition where heart is not circulating the blood sufficiently. So what are the symptoms? Usually, because of slow circulation, people feel easily tired, fatigued, or they become breathless on doing little unaccustomed activity like climbing stairs, walking fast. They make them breathless compared to previously. So breathlessness, tiredness are the two most common symptoms of heart failure. Apart from that, swelling in the legs. Many of them develop swelling around the ankle and up to below the knees. These are one of the commonest symptom and sign of heart failure. Progressive weight gain is also symptom of heart failure. Not all weight gains are heart failure, but progressive weight gain is a symptom of heart failure. Then, when they eat, they get easy satiety. They feel full very easily. What does it indicate? There is fluid accumulated around their intestines, and a little bit of food causes it to feel a sensation of fullness. So easy satiety is also an symptom of heart failure. Fourth, when they lie down, they feel very uncomfortable to breathe, because when they lie down, a lot of liquid goes back into the lungs and makes the lung fill with water, and they feel breathless. When they sit up, they find the relief. These are some of the symptoms of heart failure. Easy tiredness, breathing difficulty, swelling of the legs, feeling of bloated in the abdomen, puffiness of face, feeling cough or breathlessness on lying down, which gets relieved when they sit up. These are symptoms of heart failure. Now, what are the tests that can be done to identify heart failure? The commonest evaluation that happens is a doctor examines for the blood pressure, which is the most common cause of heart failure. If the blood pressure is very high, then it's better to be managed. Then you do few tests, like you do an ECG, an X-ray, and then most importantly, echocardiogram. Echocardiogram is an ultrasound. Many people know, to find a baby in the uterus, people get an ultrasound done. Similar ultrasound can be done to study the heart. That speaks about the structure of the heart, any defects which were there from birth, or any blockages that have been leading to decreased blood supply to the heart muscle. Also shows some changes on the echocardiogram. Most importantly, it speaks about the pumping efficiency of the heart, echocardiogram, which we call it ejection fraction. So if the ejection fraction is less than 50%, then this person is called to have a heart failure. Apart from this, we also do some blood test called an NT-proBNP. NT-proBNP. This is a hormone secreted by the heart when heart is met with excessive challenge than usual. When heart is failing, it releases more of this hormone. If when detected in the blood, we can easily diagnose a case of heart failure. So these are certain common tests like ECG, echocardiogram, chest X-ray, an NT-proBNP. These are common blood test and echocardiogram tests that would be asked to diagnose a heart failure. And then somebody asked me, what are the stages or types of heart failure? There are two types. One is called acute heart failure. The other one is called chronic heart failure. Acute heart failure means heart was apparently fine. Suddenly it becomes incapable of pumping. That happens usually during heart attacks and after some severe infections. Heart can fail suddenly. Many times it happens with dengue or severe viral infections, heart can fail. Other one is called chronic heart failure, means heart has become dysfunctional over a period of time, more than 6 to 8 months. It has become progressively weaker when you call it a chronic heart failure. Why it's important to know these two? Because their outcomes are different, their treatment are different. Acute heart failure is a serious condition, something which needs to be treated on an emergency basis in an intensive care unit. Chronic heart failure, people live with it over decades. Unless you manage them well, many of them may die for a period of time just because of sudden cardiac death or for a period of time progressive pump failure. We all have seen patients, people who are apparently fine until yesterday, suddenly they died. This is called sudden cardiac death. That means heart which is pumping well suddenly either stopped or it started beating so fast that it is not capable of pumping blood but just quivering. Unless you give electric shock, this quivering will not stop and heart will be unable to pump blood. But once a good shock is delivered, again the rhythm is reset and the pumping begins. This is called sudden cardiac death and its prevention using a defibrillator machine. We must know that people who have heart failure, which is a chronic in nature, and if their heart ejection fraction is less than 35%, these people stand to gain against the risk of sudden cardiac death by getting themselves implanted with a defibrillator. It's like a pacemaker-like device, very intelligent computer circuit, which sits on the chest, constantly monitors the heart's rate and rhythm. If ever it becomes too slow, it stimulates the heart to start contracting much faster to meet the demand. But if it becomes too rapid, where it's just quivering and not delivering the pump function, then it sends an electric shock and then resets the rhythm. People who have heart failure are 6 to 9 times more vulnerable than a normal person for a sudden cardiac death. By implanting these devices, they protect themselves. This device reduces sudden cardiac death by more than 50 to 60% in people. Now, people with chronic heart failure, when the heart becomes weaker and weaker, over a period of time, they get repeatedly hospitalized and they become less capable, and eventually end of life comes for two reasons. Either heart pumping goes down and down and down and they progressively die, or suddenly they die. What are the treatment available for these patients? There are 2 or 3 treatment strategies. One is the medication aspect, other one is a surgical or a treatment interventional aspect. Coming to the medication, you have again 2. Lifestyle. Very important to get rid of excess weight. Obesity is one of the common causes for heart failure, so please manage the weight. Second, exercise on a regular basis, at least 45 minutes, 5 days a week. Third, eat more healthy. Less of salt is very, very crucial for heart's health. Less salt. Third, when you consume calories, if you're on the overweight, reduce the calories. Then comes the fats and sugars. Lesser the fat and sugars, the better for the heart. Next, these are all lifestyle that one can achieve in terms of diet and exercise. Third, being peaceful and calm with the help of meditation or any other relaxation exercise also heals and makes the heart perform better. last in this is the medications. They're very, very important part. There are 4 or 5 groups of medicines which should be prescribed by a doctor. Do not stop any medicine without consulting your cardiologist or another cardiologist. The most common reason for heart failure hospitalization is the discontinuation of medication. So please do not stop medicines abruptly by self decision or non-cardiologist advice. Then comes fluid intake. You must remember how much fluid one can drink when their heart is not pumping well. The common notion among all people is drinking more water is good for health. That could be true in an apparently healthy person, but not in a heart failure patient. A person whose heart is incapable of circulating all the liquid which already exists, if the person drinks a lot of water, there's excess load on the heart and it cannot circulate, fluid starts accumulating in the lungs. So they're usually prescribed about 1 to 1.5 liter or maximum 2 liters of liquids. That includes water, juices, soups, whatever, buttermilk, whatever they consume. All liquids put together are restricted to reduce the burden on the failing heart. And most important thing, watch your weight. People with heart failure, when they gain weight, it usually means the retention of water, which will make them worse. So they should watch their liquids. So if there are any questions, I think we'll take it forward from here.
Useful information. So
are we going to answer that?
No, it's done, I think.
Yeah.
No, viewers, if you have any questions to be asked, kindly put it in the comment section. We'll get back to you soon.
Can we just see there seems to be a couple of questions? No, doesn't open.
Very useful.
Good day.